Right, everybody, to our last panel of the day. And so as you can see at your screen, this is our health profession student panel. It is sponsored by UA Wins. And so I will actually, I don't know if we have anybody from this particular club here, but I do believe we have their contact info. So I will leave it up on the screen in a few seconds. So you can read the slide about this particular club who is sponsoring this panel. And you have their Instagram information, their website. One of our ambassadors, I believe, is part of this club as well, lady. And so if you need to contact the club or want to find out more, go to their Instagram or send them an email and find out more about the club. All right, so I'll share this again at the end of our panel. So for those of you who missed the info, you can get it then. And so, like I said, I want to welcome everybody. This is our last panel of the day. And we do have two ambassadors who will be facilitating. However, one of them is fighting the flu. So she will just say a virtual hi since her voice is not all there right now. And our next ambassador is Kobe, who I will have him read our land acknowledgement, and then I will take it from there. Kobe, it's all yours.
All right, thank you, Renee. So before we begin, we would like to recognize that the University of Arizona sits on the original homelands of indigenous peoples who have stewarded this land since time immemorial. Aligning with the university's core value of diverse and inclusive community, it is an institutional responsibility to recognize and acknowledge the people, culture, and history that make up the Wildcat community. At the institutional level, it is important to be proactive in broadening awareness throughout the campus to ensure our students feel represented and valued.
All right, thank you, Kobe. All right, so unlike some of our other panels today, there's Karate. This is more of a, I don't know, it's the last one of the day, so it's more of an informal, right? It's more of a talk. And so we really want students to ask the questions that they want to ask, that maybe things that they wouldn't ask, I almost want to say the nitty gritty, right, of your health profession and what it's like, how you got there, what you would do differently maybe, or what you wish you knew now that you're in your health profession, you wish you knew that you knew then what you know now. And so, and that's sort of where we want to take this. And so as people come up with questions, I will ask, just raise your hand. We'll get to you. We'll let you ask your question. You can also put it in the chat, of course. But, like I said, it's kind of an informal one. So if you want to ask your question yourself, we're more than happy to have you ask your question. And so I will, since it's an hour session, we do have a big panel. So I will have each panelist sort of just say, give us your first name and the health profession you're in now, maybe what year you're in now, and then we'll start with the questions. And so we'll start with, let me see, my latest list here. We'll start with Javier.
Hello, everyone. My bad. I'm in a car going home right now. My name is Javier Limon. I am from the NAU OTD program, so Occupational Therapy program, and I am a second year currently.
And if you'd like, I can go because I'm Nikki Gonzalez. We are carpooling in the back of a car here with our other classmates, but I'm also a second year at the NAU OTD program, and yeah, excited to be here.
Awesome, thank you. And next we have, I believe, Karavi. Are you here? I think I saw you come in, or I let you in.
Yes, hi. I was this close to doing what Javier and Nikki are doing, because I just got home like 30 seconds ago. The day you need a clinic to end on time, it doesn't. Yeah, anyway, I'm Kairavi. Hi, guys. I'm a third year in the Podiatric Medicine program at Midwestern University up in Glendale, Arizona. So yeah, I'm hoping to share some good ideas with you guys. And if you have any questions about what got me into this, or even what podiatry is, that's a fair question, because a lot of people don't know what podiatry is.
All right, thank you. All right, Christina.
Hi everyone, my name is Christina. I am a second year physician assistant student at NAU in Phoenix. If you have any questions about PA school, feel free to send questions my way.
Thank you. Tatiana?
Hey everyone, my name is Tatiana Rome, and I'm a fourth year medical student here at the University of Arizona. And I will be going into pediatrics.
Cool, thank you. Eric?
Good afternoon, I'm Eric. I'm attending fourth year at Lake Erie College of Osteopathic Medicine as a DO student. I just matched into family medicine residency and we started at Eglin Air Force Base this summer.
Thank you. Brianna?
Hello, afternoon, everyone. My name is Brianna Dahone, and I am a fourth year medical student at the University of Arizona. Tatiana and I are classmates, and I will be going into anesthesia, and I'm also going to be eventually going into the United States Navy as well.
Awesome, thank you. Jacqueline?
Hi everyone, I'm Jacqueline. I'm a second year student at the University of Arizona College of Pharmacy. It's nice to meet you all and see you here. Please feel free to send any questions you have my way.
Thank you. Jasmine?
Hi, I'm Jasmine Worthy. I'm a first year veterinary student at University of Arizona College of Veterinary Medicine. And my focus is aquatic and zoological and conservation medicine.
Awesome, thank you. Alan?
Hey everyone, I'm a fourth year medical student at STNM, which is Southwest College of Naturopathic Medicine in Tempe. And I'd say as a naturopathic medical student, it's the least known of the medical schools. So I'm really excited to answer any questions on naturopathic medicine for you guys.
Thank you. Nancy?
Hi everyone, I'm Nancy. I'm a first year student at the University of Arizona College of Nursing in their Doctor of Nursing Practice program. If you have any questions about the family nurse practitioner track, feel free to ask.
Thank you. And did I get everybody? Hopefully I didn't miss anybody. And if I did, I am sorry, and let me know and let us know who you are. All right, cool. I didn't miss anybody. All right. So one thing I do want to ask is, we're already getting emails saying, hey, this person, how would I get a hold of that person? I have a question about the military program, or I have a question about this. So what I want to ask is, if you're okay with sharing your contact info, obviously let Josie know as well. But if you don't mind putting your contact info in the chat, and then students who may have questions can maybe email you a question. And then of course, we'll keep track of it too. And maybe we can share that with them a little later after we're done with today. So again, so our panelists, if you're okay with sharing your contact info, just throw it on the chat and we'll keep track of that. I know some of you are driving, so you can always let us know, hey, it's okay to share it, and we can share it later. We don't want you to get into an accident or anything. We already have one burning vehicle here at the garage. We don't need another burning vehicle somewhere else. And so with that, I think the thing on everybody's mind is COVID-19. And so I guess I'll start with that. So if some of you want to share, how has COVID-19 really impacted, if obviously you're still in school, how has that impacted school for you all, like classes, or maybe you were, put into seeing patients earlier than you probably would have otherwise, or maybe you're getting to learn a whole new side of medicine, such as like more public health focus versus, just strictly medicine. And so, if somebody want to answer, how has COVID-19 impacted you in your studies?
Yeah, I'll answer that, Renee. So as a fourth year medical student, we're mostly in clinic. I think different to some of my colleagues, some of the other medical programs, we still have a good amount of classes and selectives into our through our third and fourth year. And so early on, for clinic, it was really a damper because we had to go virtual. We didn't have the option early on, and so everything clinic and classes, went virtual. And since the beginning of the pandemic, we've now transitioned to having the option to be in person if we're clinical students, where the academic classes, they're still online. And so initially it was a challenge because a lot of the clinical learning is hands-on, outside of the clinical reasoning, the differentials, the workups, all that, and the therapeutics. I think a lot of the really, high yield learning happens hands-on, the blood draws, the patient interactions, the just learning, business and management. And so it took being very creative and still, finding ways to get value out of the education, because we're paying a lot of money, Renee. And so I think at first it took just embracing being flexible and making the most of it. But now that we've been able to get back into clinic, I'd say, it's a lot more pertinent, valuable for the clinical student. And a lot of the theory is still okay online. So now I don't think it's been getting as much in the way. We still have the safety protocols in place, right? The face masks, the shields, and that took some getting used to as well. But I think at this point, everyone's kind of adapted for the most part. And that's what I would have to share. And it was really interesting. I would say from a clinical standpoint, also early on, it was really exciting to see naturopathic therapeutics and kind of the interventions that we use as naturopathic physicians work very, very well in COVID positive patients. We were seeing a lot early on, not as much anymore, but we were seeing wonderful, wonderful results. So
thank you.
Yeah, happy to share.
I'll go ahead and go next. I'd have to say it's a lot different than they planned with the veterinary school, especially with us being the inaugural class. So they had a bunch of plans for labs coming in, but they had to shift. This semester, we're a lot more hands-on than we were in the fall. We are in smaller groups, but we just finished up musculoskeletal. So we did have anatomy lab, which was a struggle in itself because it's anatomy. But we've been able to be hands-on down at the agricultural center. So we've done blood draws on horses, hoof trims on sheep. And so they've made ways for us to be hands-on because they're pretty much labs that we need to be there in person for. So they've managed to do smaller groups. It's a little bit of struggle with all the PPE, with the mask and the full face mask on top of the mask over your mouth and our lab coats and everything else, but they've done their best to make it work. So we're hoping we can do more later on, like everybody else, but they're doing the best they can. And they've actually, it's actually been a lot more hands-on than I expected with the pandemic, but they really worked hard to make it happen.
Thank you.
I can jump on. So Eric, fourth year medical student. Back in September, I was doing some auditions, which essentially is a rotation where the whole month is an interview, and it's a program you want to go to for residency. So you're testing it out, they're feeling you out, vice versa. There's a family medicine group, and a lot of it had transitioned to straight phone calls, not even Zoom calls where you can see them, just phone calls. And especially with, I don't know, our generation, we do not talk on the phone. So that's a huge learning curve in and of itself. But really having to teach patients certain things over the phone to test them, because you can't see them and you have to describe a test that they can do in their own house and try to get results from them. So you really have to learn to articulate what exactly you want, because sometimes you can fly through certain physical examination skills looking at a patient doing 10 different things without having to explain it to the patient. But when you're trying to test their medial meniscus by having them twist their knee, you have to make sure they're safe. You have to put them in an environment, do 10 different things explaining it to try to get the results that you need out of it. So definitely a learning curve on how to explain, articulate, and eventually teach, which I think will be helpful going forward if you do want a teaching position, silver lining, but it's been pretty difficult as well for a certain period there.
Thank you. Right, anyone else?
I think I can go next. Essentially, what everyone else has been saying for us, and I'm in the 4th-year medical student class. And so for us, initially we were in virtual rotations, and then we transitioned back into in-person learning. I think the major things that change, which we'll see how this continues, is 1st and 2nd year students are largely doing virtual classrooms. In your 1st and 2nd year, you're not in the clinic as much. About once a week, they still go in for their societies days, where they will still go in and see either a standardized patient, who is somebody who is like an actor, to practice their clinical skills, or they'll go into the hospital and see patients there. And so I think those things have been are kind of like the major changes. I think the other thing, like Eric said, the telemedicine thing has been pretty big, and we've been doing a lot more telemedicine students, which is interesting, especially with pediatric populations, and trying to get, maybe your 2-year-old to sit still in front of the camera in order for us to be able to do some examinations on them. So that's been very difficult for parents, especially while having other family members in the room, or another student is online learning. And so it's definitely been interesting and a little bit difficult. And so we're seeing the challenges as well as the benefits in telemedicine for patients who are maybe immunocompromised and who are high risk, even pre-COVID, for coming into the clinic. Some of them are actually, doing well with the telemedicine, and it is something that they, prefer, and it is somewhat helpful for them as well. So.
Thank you. Okay, Robbie, were you going to say? Yeah, go ahead. And actually, after you're done with your response, I actually would like you if you could explain, your health profession, because sometimes I think, as you mentioned, sometimes people don't know exactly what it is. And so, and then after you, I'm actually going to ask Alan, because he was so excited to tell us about naturopathic medicine.
Yeah.
So after you're done, I want him to tell us all about what he's doing.
Yeah, absolutely. So I know a lot of you guys talked about telemedicine. It's interesting because for us, with podiatry, we have had zero telemedicine, because this is not something you can do on the phone or even on the Zoom call. I mean, you would have to do some kind of crazy acrobatics to put your foot on the camera. So we haven't had any kind of telemedicine, which is interesting because I've heard so much about everyone's perspective, and we only lost 1 month of rotations. We would have traditionally started in October, but because of COVID, we were pushed to November. But since November, we've been out in the field, going to hospitals, clinics. Our rotations have gone on like they would have any other year. And I don't think I've done a single telemedicine visit at all in any of these rotations so far. So that part hasn't really changed for us, except for losing out on that 1 month initially. But other than that, things have been fine. And I think I'm in a unique situation because I was a 2nd year when COVID first hit. So I was still taking classes. We still had labs. So all of that definitely got, jumbled up. I mean, we were all going to online classes, online labs, whatever that is. So that was really tough to get adjusted to. And I think the current 1st years are having a tough time with having anatomy lab online, especially because, I mean, certain things you just got to see. I mean, there's only so much that'll be helpful virtually. So they're not able to go into the labs and touch the tissue or go back and study before an exam. So I think current 1st years are taking a far worse hit than we did. But I hope that current undergrads who, when they start their programs, I think things will have transitioned back into in-person. So I'm hopeful about that. And okay, so what is podiatry? So podiatry is basically foot and ankle medicine. So when we graduate, we will have the DPM degree, which is Doctor of Podiatric Medicine. And when you graduate from residency, it's a 3-year residency after med school. And when you graduate, you are a foot and ankle surgeon. So ankle and below the ankle, pretty much below the knee even, because we often handle Achilles problems, gastrocnemius problems, and things like that. So pretty much anything below the knee, we would be specializing in. So that's what podiatry is. And you are the residency is considered a surgical residency, so you are a surgeon at the end of this, even though it's limited to the foot.
Thank you. All right, Alan, you're up.
All right. Yeah. Thank you, Renee. So naturopathic medicine, what is it and why we all deserve to know about it? So naturopathic medicine is one of the, three forms of medicine here in the States. We have osteopathic, like Eric is representing. We have, allopathic, like Tatiana is representing, and then we have naturopathic. It's a 4-year medical program. What's nice about naturopathic medical schools right now is that residencies are available, but they're optional. So as soon as we graduate, we have our NPLEX, our board exams. We actually follow a lot of the USMLE material, and it's to a big degree based on a lot of USMLE like board questions. The big difference I would say that distinguishes a naturopathic physician from other physicians are our naturopathic tenets and then our naturopathic therapeutic order. So our naturopathic tenets are amazing. I mean, I love them. It's what I fell in love with, why I chose naturopathic medicine. I was going integrative my whole undergraduate career until it came time to apply to naturopathic medicine. But the principles are a lot more, holistic, if you would, and there's a lot more nature cure involved. Some of the principles, just to name, a couple, are tolle causam, which is identify and treat the cause. So as naturopathic physicians, we really, make an effort to identify the underlying cause of disease, treat that using naturopathic, holistic therapeutics by following the therapeutic order, which of course starts off with the most fundamental, establish the foundations for health for each and every individual, and then work our way up, tonify weakened systems, eventually, make our way up to pharmaceutical intervention and surgery. Depending on what state you work in, the licensure and scope varies. We're licensed in 28 states, I believe, as of right now, maybe 29. Our lobbyists are always working hard. And here in Arizona, it's great because we're considered physicians. And so we'll have the same scope of practice as Tatiana and Eric, including minor surgery if you want. But one of the big differences is that as of right now, there's not many hospital privileges available for NDs. And so I think the VA just last year in 2019 opened up some positions for naturopaths. So that was really exciting, especially for military folk. There's so many great interventions for our VA and our military communities in regards for both pain and PTSD. So that was really exciting for the community. But as a naturopath, your positions are most likely going to be in private practice, in small clinics, or in larger groups, with other NDs. There's more and more multi-degree facilities where they have an MD, maybe a DO, PA, nurse practitioner in office, and they can refer, which I love. I think naturopathic medicine really shines as primary care and family care. That's really, what we're geared toward. But there's a ton of other wonderful specialties, pain management and regenerative injections being a popular one that I'm actually going into. And then there's, complementary cancer, there's cardiovascular, and a lot of endocrine, a lot of hormone work. So there's a lot of opportunities, but as an ND, but a lot of them are self-made. And I think for anyone considering it, that's something really important to keep in mind, is that unlike, our DO or MD opportunities where you'll probably have several job opportunities, after residency, whether it's through a hospital or whatnot, as an ND, a lot of it is self-made. You've really got to think about being an entrepreneur and a small business owner, as well as a clinician and physician. And so I think that's where some of my colleagues may have been surprised. They thought, oh, it's easier to get into ND school. We don't require an MCAT. So that's actually kind of really nice. And so I think a lot of students, they think, oh, great, I don't have to take the MCAT. It's not as competitive compared to other schools. I have a greater chance. And they get through expecting the same opportunities and that same, power or responsibility, but then you got to make their own position. And I think that catches a lot of ND students off guard. So that's a brief synopsis of naturopathic medicine. There's so much more to it, but I've definitely loved it as someone who was always more interested in the holistic, the connecting the dots, the best of science and the best of nature, and loving my herbs, and using rosemary all throughout undergrad. Naturopathic medicine was for sure a perfect match for me, since we cover botanical medicine, traditional Chinese medicine, we cover pharmacology, but to a lesser degree homeopathy, manipulation. So and I think Eric, you guys cover some manipulation in your program. We do too. So it's very well rounded, and it's been a wonderful match for me. Hope that was valuable, guys.
No, it was good. Thank you. Yeah, we do get questions every now and then, and so it's always good us as advisors to learn more about it, because sometimes we're caught off guard. We're like, let me look that up really quick. Or lately we've been getting questions about genetic counseling. Like, I want to do this. So what is that? And I'm like, give me a second here.
I just found out about that myself, Renee.
Yeah, yeah.
So I hear you.
So, and also, since I mentioned that, so lately we've also been getting a lot of questions about like nurse practitioners, DNP program, and PA programs, and we've also realized that they're getting a lot more competitive. And so I'd like to ask both of our DNP and our PA students to kind of talk a little bit about the programs, how they're maybe similar, if how they're a little different. And so hopefully once you're done with your education, like what do you expect to do like once you get out there into the work field? So I'll start with Nancy, and I'll go with Christina if you don't mind.
Yeah, hi, I'm Nancy. I am a first year DNP student over at the U of A College of Nursing. My specialty is the family nurse practitioner specialty. So I actually graduated from U of A with my bachelor's in biology, kind of took a gap year and worked as a scribe, and then went back to the U of A to get my master's in nursing through their MEPIN program. It was an accelerated 15-month program. And after that, I was able to work out in the field as a registered nurse for about 2 years before applying and going back in for my DNP. So I was a nurse over at Banner University, Phoenix, in the neurotrauma progressive care unit full-time. And then now I work per diem over at an orthopedic specialty hospital as a nurse there while going back to school. So for the FNP program, it's a 27-month program. So the first about year and a half, I'll be in kind of didactics, doing pathophysiology right now, pharmacology next semester, that kind of thing. And then I'll start full-time clinicals that whole last year and working on my DNP project. And then after that, hopefully as an FNP, family nurse practitioner, I'll be able to work really anywhere. In the primary care setting is an option, or even specializing. I've seen nurse practitioners in neurology and orthopedics, seeing patients both in the hospital and in the clinic. So the options are open there for whoever wants to do the FNP route.
Thank you.
Hi, my name is Christina again, and so our program is, after hearing Nancy talk about the FNP program, it's very similar in the sense that, you need obviously your undergrad, and PA schools really value your clinical healthcare experience before getting into, before applying for PA school. So they really want you to understand what it's like to work in healthcare, working with patients, making sure that you can connect with patients, and you're familiar with the profession as a whole. They want you to shadow, they want you to volunteer everything you can. So a lot of schools really have a high requirement of hours necessary for admission, which I think is great, because it really ensures that you want to do this profession. So that's a little different there. And the program is 24 months. And so it varies. So some programs are 27 months and some are 24. The one at NAU is 24. The whole first year is didactic. So we're in person in classes like every single day, all day, over the summer full time. So we can't really work, which is a bummer. So you're not really seeing any, patients or anything like that until your clinical year. So in clinical year, you're in rotations 24/7 as well. And pretty much, I feel like, and you're studying on your free time, and it's great. Like, I love the clinical year. It's awesome. I'm seeing patients on my own. I'm working with NPs as my preceptors. I'm working as PAs or with PAs as my preceptors, MDs, DOs. Everyone is helping me learn, which is nice because you kind of get different viewpoints of, how everyone treats patients and like the way they approach their treatment plans and stuff like that. So that's nice to kind of get that. Forgot to mention, like, during our didactic year, we do follow, I'd say, more closely with the med school model. We do have a lot of classes that have instructors from U of A that also teach med students. So it's kind of nice getting that same or similar instruction in the beginning. And we are really held to high stakes and high expectations throughout our clinical year and our didactic year. So it's a really intense 2-year program, but it's nice because when you're done, you take your boards, you get certified. And I think the beauty of PA is that you can switch specialties whenever you want, which I love that. I have no idea what I want to do when I graduate in 6 months, but I know that if I don't like what I choose at first, I can switch and find something else and keep learning. So that's what really drew me to PA. And so, yeah, if you have any other questions, feel free to let me know.
Awesome, thank you. So next, I'm actually going to go with Jacqueline about pharmacy. And then, so let me first say this. So, a lot of times we get students who say like, oh, I'm interested in pharmacy, but I hear it's changed or it's changing, or, I think they're doing more with COVID stuff, or, different things that we get about pharmacy in questions. So maybe you can explain a little bit of what your experiences have been in pharmacy school, where you see yourself going, and how maybe some of these changes have been, either affected you or just really maybe opened up different paths for you in pharmacy. And then after you, I want to go with our OT NAU crew and have them, talk to us a little bit about OT, because believe it or not, we also get a lot of questions about OT, especially, I will say, students who maybe don't know what health profession they're going in, or maybe they're thinking, I want to do this, and then they learn about OT and they're like, I want to do OT instead. And so, so we'll let Jacqueline sort of talk a little bit about pharmacy, and then our OT crew can jump in and tell us a little bit about OT.
Okay, hi again. So I can talk a little about prerequisites, what to expect. Going in, let's say you're interested. One thing I do highly recommend, go shadow, go volunteer, work in a pharmacy. You don't know if you're gonna like doing it until you kind of see it yourself. You can think that you might like what you're doing, and then you're like, oh my gosh, this is not what I expected. So shadowing, I think, is a great way to see if that's something that is if you can see yourself doing that. Prerequisites, it's about 2 to 3 years of prereqs. You don't have to have an actual bachelor's degree to get into pharmacy school, but we do have prereqs, as I mentioned before. Some people get it done in 2 years, some people in 3, and then by then you can apply to the program. There's also like a BSPS program. You can go that route too, which is a Bachelor's of Science in Pharmaceutical Sciences. I don't know too much about that route, but some people do go that way. The program itself is 3 years of didactic curriculum and then 1 year of rotations. And in between each year, we have like what we call IPPEs. So they're like introductory experiences where we go and we work with patients in the field, whether it be in a community setting or in a hospital setting. And I've had one of those. And I'm also in a rural health professions program where we work in rural communities in Arizona. And I highly recommend it. It's awesome to see. I grew up in Phoenix, so I'm a very big city girl, I could say. So it's really eye-opening to go ahead and work in those communities. But yeah, I think I've learned that there are many routes that you can take with pharmacy. It's definitely gone a lot of ways. If you like informatics, you can go that route. You can work in a community health center, and that's kind of where you work in a smaller community with it's a really good interprofessional experience. You can work with doctors in a hospital, or you could work at Walgreens as well. So many different routes you can take, and it's definitely awesome to see everything that's kind of starting to open up for us.
Awesome. If you don't mind me asking, what rural area did you end up working in?
I went
And maybe other rural areas where other students go to.
Oh yeah, all over Arizona. I went to Sierra Vista. I worked at Chiricahua Community Health Center, which was really awesome. And next summer, I'll be going to Cottonwood, Arizona, which is about 15 minutes away from Sedona, at Valley Verde Medical Center. So that was really cool too.
Awesome, thank you. All right, our OT crew.
All right. We got a whole car here of OTs. So I'll try not to go in a rabbit hole here because it can be a little difficult to understand what occupational therapy is. But to kind of make it at its own most basic terms is we look at occupations as something as a meaningful activity, or it's not just a job. So we use meaningful activities as a form of intervention, but they can also be our end goal. So if you find, let's say you have a leisure activity of quilting to be really meaningful, if you have an injury, we might use quilting as a way to rehabilitate you and get you back into your normal routine. Or we can also make the end goal to eventually get back to quilting. So we have a lot of space for adaptations and forms of intervention. We can work with populations across the entire lifespan. So we have occupational therapists that work in NICUs, and we have OTs that also work with the geriatric population. So we're everywhere from the beginning of life to the end of life, in between, and we work in just about any setting. We can be in schools when it comes to pediatric schools, hospitals, outpatient clinics, and the same goes for the adult population. We can even work in mental health. So there's a lot of opportunities for occupational therapists to kind of find a job for themselves. As long as you can relate it to meaningful activities, you can basically do any kind of job. We don't prescribe any medications or anything like that, but we can assist in consultations or assessing clients for the potential of getting occupational therapy. So I feel like that was the very basic about occupational therapy. It's a big world. You can do just about anything that other professions can do. We tap a little bit into PT. We tap a little bit into maybe psychology, behavioral health, and stuff like that. So sometimes it can be a little hard to differentiate what separates us from other professions. Anything
Awesome, thank
to add, Javi? We're good.
Thank you. Well, I mean, and which makes sense because, we see prereqs, sometimes students are like, wait, I have to take 3 psychology courses? And so sometimes they kind of question us and go like, are you sure that you have to take 3? And so hearing it from you saying, hey, we kind of go into different areas and we have to sort of, go all these other things. And so it's great to hear it. And so next I want to go with Jasmine, and I know you mentioned, veterinary is one of our newest programs. And so I know you mentioned the specialty, kind of the area that you're going into. And I don't know if you could talk about maybe, when you go to veterinary school, do you already have an idea what the area you want to go into? Or do you kind of explore that a little bit in school? I know this is, I believe, your first year, but how do you pick a specialty, right? Versus working with aquatic marine or, working with cats and dogs or farm animals or, whatever it may be, reptiles, which I can tell you would never be my specialty. But how do you pick that? And then after that, I believe if I'm remembering correct, I know Eric mentioned this earlier, and I think it was Brianna who mentioned military. And so after Jasmine, if you two wouldn't mind talking a little bit about, military and then your health profession and how all that is going to work for you. Thank you.
Sure. Yeah, I can. So for a lot of students, which I can actually answer this, I used to teach vet students before I got to vet school. Some students come in with an idea of what they want to do, and some have absolutely no idea what in the world they want to do with their lives. But it doesn't matter. From what I see a lot is there are some students that stay on that track, and then there are some students that come in with one idea, and then after a couple of classes they're like, yeah, never mind, I'm going to do something else. So in veterinary school, it's pretty much all encompassing. So you'll get a little bit of experience in kind of each area, some more than others. Some people come in wanting to do surgery, but once they go through their surgical year, they're just like, that's not for me, and they want to do something else. So it all depends. You literally don't have to come in with an idea. A lot of people don't come in knowing what they want to do. We get trained in radiology, dentistry, surgery. You go through oncology courses. We have, well, they're still building the curriculum for this one, but with other ones, you have nutrition classes, infectious diseases. And so you're kind of working in all of the areas. As far as specializing with particular animals, you're mainly going to get small animal and large animal in vet school. So primary focus is going to be small animal, cats and dogs, with large animals, with equine. Those are the major focuses, especially when we take NAVLE, which is the national board exam. So most vet schools, you'll get your farm animal and your food animal experience, and cats and dogs. There are some electives, but most schools, when it deals with exotics and aquatics, those are actually done outside of school. There's very few programs that have focuses like that. There's maybe 3 or 4 schools that I know of that have some type of aquatic medicine program. So it all depends on what you're looking for. But with the, like I said before, with aquatics and exotics, that's really one of those where you kind of have to be a self-starter with finding experiences outside of class, mainly by shadowing and volunteering. So those are where those experiences come from. And you can do residencies in those areas as well and get certified.
Thank you, Jasmine. So then after Eric and Brianna, I actually want to ask, Tatiana mentioned in another panel about some rotations and getting ready for residency. And so maybe you can talk a little bit more about that process, because I think that's another process that our students sometimes don't realize, hey, there's more of a process once you're almost done with medical school. So so we'll go with Tatiana after Brianna and Eric.
Right, so I'll jump in. I received the HPSP scholarship, so it's the Health Professions Scholarship Program. I'm with the Air Force. Each branch has a select number of scholarships they give out each year. There's 3 and 4 year scholarships. It's usually a year for a year. So when you get into medical school, or I do believe they have it for PA programs and a few other programs, you're usually already talking to a recruiter. There's specific healthcare profession recruiters you can talk to. When you get in, you make a deal with them, and they essentially will pay for your schooling, so you never see a bill. And then for every year they pay for, you give back a year. So I wrote down a few things just to make sure I hit everything and answer hopefully a lot of questions, but always I put my contact information in there. You can email me with more. So the school's paid for. Your insurance is paid for because you have to have insurance for the 4 years as well. You get a living stipend of about $2,200 a month. You get paid a little bit more during residency too, which is nice. So while you're in school, you're a second lieutenant. And then when you graduate, you go up 2 ranks and become a captain. You're reimbursed for books, laptop, your boards, which is like a couple $1,000s, stethoscope, white coats, a lot of different expenses. You still get military discounts on, everything like that, which is still kind of nice. One real huge benefit that I saw is you don't have to deal with insurances, pre-authorizations, nothing like that. Pretty much if you think your patient needs something, it's approved. TRICARE is like the best insurance and approves anything as long as the doctor wants it for their patient. Overall, you're also dealing with a great clientele. So your patients are usually healthier. They're extremely respectful because they're military and their family. They're usually, they want to be healthy. They want to be fit. They want to do their job. So, they're usually already running, exercising. So that's always like really great. Also, because they have such, healthcare at their fingertips, anytime they have a small issue, they go to the doctor and get it taken care of so it doesn't snowball into bigger issues. So you see them a lot, you have good relationships with them, and you're kind of serving your country too, helping them who help us. Usually, so a couple things, you can do a residency with them, like I'm doing. There's a separate match, and it's a little bit earlier than the civilian match, but you can do a civilian match if you'd like. So there's a few differences. I'll be active duty as soon as I start my residency. If you do civilian, you don't do active duty. So for instance, if I do my 3 years in family medicine, and then I give my 4 years back. So really I'll have 7 years of active duty time by the time I'm done with my give back. And I mean, you're almost like halfway to retirement to that point too. So you can retire at 48 for me, and then go civilian, do whatever you want. You have healthcare for life, like pension for life, great stuff. There's fitness standards too you have to meet, which, keep me active was one reason I wanted to do it. But the match and residency is a little bit different. It's based on scoring. So you're not limited to any specialty. There's a miscommunication if you look online, like, oh, you can't do derm, you can't do peds. You can really do whatever you want. It is extremely competitive though for different things. There's a scoring system based on your boards, your letters of recommendation, your research. And so you can pretty much know how competitive you are and kind of go from there. If you really want to do orthopedic surgery, for instance, it's one of the most competitive in the military, but say your board scores aren't that great, you can still graduate and do a general medical officer where you do the physicals, maybe a quick 3 to 6 month deployment, and you get 5 extra bonus points so that the following year you can reapply to any residency and you're going to have maximum points and get the residency you want. So it's a very extensive, separate process. You do a lot of research online, or contact me if you have any other questions, but that's the one I'm doing.
Thanks. And then Brianna?
Yeah, Eric, I think that was an absolutely great overview, and I love that you mentioned the military discounts. It's kind of a nice perk. And unlike Eric, I'm doing kind of the deferment path that he was mentioning. So through medical school, like you said, you can go that military route and either go into residency or do the GMO, as he called it, which usually that general medical officer tour, you're kind of like a general practitioner wherever they need you. And it's usually a 2 to 3 year commitment before you can reapply into residency. And those 2 to 3 years count back towards your payback that you owe during medical school. So sometimes it's nice to go through that route, pay everything off, and then you can enter the civilian match if you decide to leave the military. With the deferment that I'm doing, it's basically on a needs basis. So, and that's also by specialty. So for me with anesthesia in the Navy, that is especially that's really needed, and there's a short supply of anesthesiologists. So I was able to apply for that deferment basically. And what that means is that I can go civilian for 4 years, and then I go back active duty as an attending physician and pay off my 4 years now that I owe during medical school. During that time, you're not active duty, you have no obligations like you do during medical school. So like Eric said, with some of the perks that we get, we also have obligations as well. So you do every year about 45 days of what is active duty training. And that can look different throughout all your years. I'm sure Eric went and did some training with the Air Force like I did with the Navy. And that really, it's not anything like basic training. I feel like when we put out that training aspect, it is kind of a little daunting and scary, but really it was about 200 other people in my class all throughout the country, and about 95% of us were all other medical students. There's also dental students in there, nursing students who are all going through the same scholarship program. And you spend about 5 weeks learning about military culture, history, basically how to put your uniform correctly so you don't look like an idiot, which can happen, how to salute, what your ranks are, and really just kind of getting a sense of military camaraderie and what that looks like within your branch. So it is really cool. Not only you get to take care of these patients, as Eric described them so well, but working with some really amazing people. I was able to rotate at a naval hospital out in Virginia, and a lot of the anesthesiologists that I worked with just came back from the COVID response in New York. They were on the massive hospital ship, and so talking about those experiences that I think the military offers that you don't really get in other private practice or civilian settings is pretty cool. And so, like Eric said, if you guys are interested, we're more than happy to talk about it.
Yeah, at training, you only get screamed at for like the first week. After that, it kind of tones down a bit, but you definitely get screamed at, kind of like the videos you see online and stuff.
Yeah, or they like even held our coffee and like desserts or like anything. They restricted what you could eat for like a few weeks, and everyone was going through withdrawals and headaches because you couldn't have coffee. So you make it through. It's fun.
So you'll be used to your intern year once you all right. So Tatiana, so like I said, I guess a little bit about like you know, and maybe I say it wrong to my students, but I always say like it's like applying to like college all over again. Like you're doing residency, you're doing all these maybe visitations to programs that you're interested in, and I try to explain match as best I can, and because sometimes they're like, oh, there's more to it. Like I'm like, oh yeah, there's more to it. And so if you could give us a sort of a quick overview of sort of where you're at now, like and kind of what the process is like for residency and things like that.
Yeah, no problem. I definitely, as an undergrad, was like, once I get in, everything's smooth sailing. And then I got in and I was like, oh my gosh, there's more to learn, what's happening. And even as a fourth year, I'm still like, I just YouTubed a video on the match the other day. So it's definitely a lot of learning as you go. But essentially, so once you get into medical school, briefly, so you do a preclinical years. So that is 18 months right now. And so what happens is you're essentially just taking classes and you're getting your basics down for the first 18 months. This is all leading up to your step 1 exam, which is now pass fail, but it's a big exam, several hours long, very, very, very stressful. But being pass fail now, there's supposed to be less of an emphasis on step 1 for determining, what residency cutoffs that you, cutoff scores that you'll require. So it's a very, very good change, at least from my perspective. So during the first 2 years, you do get a few bits of clinical exposure about once a week. You will probably go into a clinic setting with practicing on kind of actor patients or real patients. And then in that point, you're getting your clinical skills down, your history, your presentation, working on your differentials and kind of applying things that you've learned. Then you move on to third year, which is basically where you're in the hospital, you're doing clinical rotations. And basically, most of your grades are determined by how you're doing on your clinical skills, your history, your presentations, as well as an exam that you'll take after each rotation. During that process, it's really the time where you're supposed to kind of try out all these different specialties and see which one fits for you. I was a person who was absolutely 100% sure they were going to OB-GYN. I did my pediatrics rotation. I was like, I kind of like it. And then as I progressed to my fourth year, which is really where you get to do your sub-internship, where you really are part of the team and you can really try to practice being an intern and seeing if this is the right fit for you. That's when I realized that I was leaning towards pediatrics, and I ended up applying to that specialty for my residency. The application process is kind of exactly like you said, you're applying all over again. You go online to this database, you put in kind of your step 1 scores, your step 2s, which are your second board exams you take after your third year. You'll put in, the grades from your clerkships, which are on a like pass, high pass honor system. Your preclinical years, pass, fail, they all go on there as a transcript. And so as well as your entire CV, all the things that you've done, all the extracurriculars that you were a part of throughout these last 4 years and even in undergrad. And some people even have some really amazing things they're part of in high school that may be significant enough to put on your CV for your residency application. That then leads to the day you submit, which is usually around like maybe September 15th, super stressful. You press the submit button, you start sweating, go into this deep panic, and then relax. And then you start getting all these interview offers, and it's really scary because, the interview offers come in through your emails. You have to sign up as quickly as possible. Super complicated and confusing, but as you reach there, you realize everything's fine and you can relax and breathe. Then after all the interviews are said and done, we go into the match process, which our match list is due on March 3rd. So that is super fun and very close, where you essentially take all these places that you've interviewed at and you create this list of the places that you want to go to, starting with the one that you love the most to the one that you hate, that you like the least. So maybe you have like 10, 12, 13, somewhere around there, places that you interviewed, and you put them in your order of preference, and you put it into this rank list, and it goes through this national registry, which basically takes the school's list and sees if, the school says, okay, Tatiana, we like Tatiana, we're going to put her on our rank list, and I put them as my number one. Then on mid to late March, we get this, email that's like, you matched, and it means you're going to have a job next year and everything's great. And then the Friday of that week, you will open up an envelope with everybody in the country and you will see where you will be going for your residency. And it sounds super terrifying, but as you go, you take little baby steps and somebody explains what to do next, and you start sweating, go into a panic a little bit, realize everybody next to you is also panicking because we're all in the same boat. And then you relax and then you just do it and it works out. So definitely very scary, but lots of things to learn, a very steep learning curve, but you'll learn as you go and you'll figure it out. And just remember that everybody is panicking along with you.
Thank you. Well, and I think that's a common thread, with every health profession here, is that stress, that panic, and then that sigh of relief from like, I did it. And I'm sure once you're all done with your health profession and you're out there practicing, you'll be, those memories will hopefully be, locked away somewhere. You'll still remember them, but hopefully they're not stressing you out too much. And of course, that means that we'll at one point call you back, and hopefully you can present to other groups and say, hey, I'm done with that part, so now I go on to this, right? And so, we're at 6 o'clock, and so that's the end of our show here. However, if anybody of our participants has questions and our panelists have a few more minutes and you want to, ask them a few questions, we'll keep the chat open for maybe like 5 minutes or so while they can ask their questions. But I do want to thank everybody for coming, and I think Kobe might have like a specific closing for us. And so I'm also going to share the sponsor, the club sponsor for our for this session. So I'll let Kobe close it, and then I will share the screen.
And I just want to say a few things before Kobe closes for us. And part of this is because these are events that we work with our ambassadors. And so I just want to recognize, our panelists who were ambassadors, and, it's wonderful to have you back. And thank you for taking the time to be here. Karavi, Tatiana, Eric, Brianna, and Nancy were all pre-health ambassadors in our office. And we really appreciate it that you've come back. And this just tells our ambassadors now that, there are other role models that are out there, and the information that you provide is so valuable. And I truly, really appreciate it. And other panelists, I've worked with you, our office has worked with you also. And also the veterinary school, we're so excited to start to partner with a new medical school and the veterinary school. So it's been a wonderful day. This panel just set the bar. And again, we've never done this virtual thing before, and we were worried this panel was so huge that we wouldn't get to everybody, but all the information is so valuable. And I want to thank everybody. Okay, Kobe, it's yours.
All right, thank you, Josie. So please thank all our panelists for taking the time to be part of our 2021 Virtual Health Professions Expo. That officially concludes our event today. Thank you all so much for coming, and we hope to see you guys at future events.